All right, Kyren, could you really quick just give us a little background on your academic experience as a researcher?
Yeah, yeah, absolutely. So, yeah, look, I did my PhD about a decade ago now, and I've been here in the UK past 6 years. I did my first postdoc, so that's your first scientist position after your PhD, with the University of Cambridge, where I was studying breast cancer cells in the lab, and after that, I've moved on to University College London, and where I'm studying the early cancerous development in the lung and the upper airway. So I'm really fascinated by how cancer develops, and in general, really, like Daniel yourself, I'm just a meathead. Just really love being in the gym and just trying to understand how the body really functions. So I'm really fascinated by various aspects of physical training.
So, as someone who's steeped in the research, you're going through papers, you're learning what to look for and how to look at the strengths and weaknesses. What are some like common things like meatheads like me and just the people who just see the conclusions of the studies, they only read the abstracts or the titles of these blogs that reference a study. What are some of the pitfalls and misconceptions from approaching research like that? And what have you noticed when actually going past those attention grabbers and looking at the data?
Yeah, that's absolutely correct. So if you read your articles or your magazine reports, you really are not getting the um, you're not looking at the what the article really is, the published article really is saying. So what I've found is really trying to understand the what exactly the researchers did, how they performed the trial, and the various limitations that you could, for someone like me, is fairly glaring. But I'd love to explore this aspects a little bit more in the upcoming episodes.
Cool. Well, let's hop in this study, which stood out to me. A lot of people had some sort of emotional reaction to it, and it was the effect of vitamin D supplementation, omega-3 fatty acid supplementation, or strength training exercise program on clinical outcomes in older adults. Really quick, could you just explain why looking into this field is so important?
Yeah, absolutely, Daniel. So, I mean, aging really needs to be revolutionized. I mean, we have uh, in the next in 30 years, we're going to have many more people getting older, staying alive, and are actually active in their community, working. And really, if we are going to try and minimize the effect on the healthcare system, we really want the older generation to be active and healthy, and not only just for the healthcare system and the economy, but also the one's quality of life, really. So I think a study like this is very important because it really tries to explore what is a simple and effective solution that one can do, not necessarily the huge aging economy that is the consumer economy that currently exists at the moment, where people are touting various pills and supplements that is not currently actually studied and trialed in this manner. So I think something like this is very important.
So this specific study, they had 2,157 healthy individuals, men and women over the age of 70. It was a randomized, double-blinded placebo study. Could you explain what the strengths were of this study?
Yeah, absolutely. So I think the fact that it was double blinded. So what double blinded really means is that neither the researchers or the people that are organizing the trial nor the patients know what treatment they are on. So this is extremely important to reduce the bias of the placebo effect. So what it really allows one to do is that if a patient knows that they are in a trial that is going to have an effect on show an effect on physical characteristic, they will maybe tweak their exercise regime, maybe sneak in a few more extra reps, maybe do it a little bit longer, and this might affect the results of the trial. So the fact that it was double blinded, and the way that happens is there is a code generated, and this specific code is specific for a treatment regime, whether it be the vitamin D, the omega-3, or the strength regime, and that code is then given to the patient, and the patient knows exactly what, based on that code, what to do. So that's the one strength that I thought is very important. Making sure that it's placebo controlled is also very important. So both the vitamin D and omega-3 arms were placebo controlled using a placebo drug. And the strength-based regime, the placebo for that was a joint mobility exercise, set of exercises that the patients were doing. The other strength that I thought was really important from this set, that there was a huge adherence to the study protocols, which means that we can reliably say that we can believe the data at the end of the day.
And also, this was a pretty long follow-up for this study, correct? I think it was
Yeah,
a few
absolutely.
years.
Yeah, 3-year follow-up. So I think that's very important. For as previous studies similar to this had a shorter follow-up, and you really want to know what the effect of these three treatment arms are after a decent time. And 3 years is a very good follow-up for this.
And do you have any information about the strength routine that they were doing? And you said flexibility was the control for the placebo, correct?
Yeah, that's right. Yeah, yeah. Let me let me just pull that up, Daniel.
Sure. Yeah. That's what stood out to me was this. I was just looking at the strength training part of this study, and
Yeah.
it blew my mind that after 3 years of dedicated strength training in these elderly individuals, that there wasn't really a statistical significance in the test at the end,
Yes,
progress.
absolutely. So I guess that's the regime was the strength training regime was sit to stand, then a one leg stance, pullbacks seated using bands, external shoulder rotation, and steps. So I completely agree with you that just by seen an effect. But one of the limitations that I found from the study, and I think that's one of the major limitations, is that this population is a population that already was performing moderate to high level of activity, and and if this population is performing this level of activity, one might think what more improvement could you actually achieve. The second, limitation, I guess, with the strength training aspect is that they one of their endpoints is called SPBB, which is short physical performance battery, which is essentially a test, and a lot of it is about balance and lower extremity strength. Their SPBB score at baseline was 11 out of 12. So an extremely high baseline score, which I feel, again, not many strength training regimes could actually improve that to more than 12. So you're already maxing out.
Yeah, that's interesting because in that test they had the sit to stand, which was in their program. They had the balance test.
Yeah,
Um, so I'm wondering if their training was progressive somehow, or if it was just a routine you added on top of your current physical activity for 3 years, which I think I read in there. They didn't have to stop what they were already doing. This was
that's
just
right.
in addition, correct?
Yeah,
Yeah, so if they're already performing well enough and they kind of just maintain it and they're still performing great, I mean, that could be a beneficial thing. If you're in your 70s, 3 years later, you're still getting an 11 on this test. That's not
exactly.
necessarily implying that adding exercise is a negative thing or
Yeah, the fact
worthless.
that it did not reduce is already a bonus. And one of the if you scroll through the data, actually, one really interesting thing that they did find was there was a reduction in falls. which again, this is again fascinating, and it confirms the previous data set where they use a similar strength-based routine to show that in frail adults, they saw a reduction in falls. And I think that's very important. A fall for an elderly person is a game changer. So a broken bone or a broken hip, going into surgery, that's really the quality of life after that is tough after that. So I think if you this exercise routine, if you can maintain and not reduce falls, and that's already a game changer.
And if that would have been the heading of the article, it would have a different feel to it, because um, increasing performance in your 70s is one thing, but decreasing the falls, which that one event of a fall can be catastrophic and have a long-term negative, um, impact on their life in general. So,
Absolutely.
I mean, that's a win right there, it sounds
Yeah, I
like.
think that, if we look at magazine reports or articles like in that way, I think a heading that would be great. But you have to know that you have to bear in mind, I guess, research articles like this, they don't go for headline grabbing statements, but simply stating the facts and stating the conclusion. And they went out at the start to look at 6 primary endpoints, and overall, yeah, they do not see massive differences. But that's what, I guess, as a scientist, you go in and you can read the article and look at the various aspects, scroll through the data and see whether there's any hidden gems, which I think there are some in this case.
So could we go over some other limitations in the study? We kind of covered the strength training, how the SPB score, really, they had a high one coming into it, and they were already had some sort of exercise routine going in. What about the omega-3 and vitamin D?
Yeah, so I guess another point that I want to make about the strength training is that half of the population were healthy ages with no pre-existing conditions. And I guess one question we should probably ask is, if we had to repeat this trial on frail adults, I would imagine you would have a much different conclusion. So I think that's to be seen, and I hope that the trial organizers do not stick with these healthy population, and really look at the effects of strength training on people who have probably 4 or 5 SPB scores. So that would be really fascinating. With the omega-3 and vitamin D, what I really found interesting was its effects on infection. I think that's really topical at the moment with coronavirus going around, and people, I guess, elderly people being one of the greatest risk of being hospitalized and dying of coronavirus. And omega-3 was shown to reduce the risk of infection of upper respiratory infection, especially by 10%, which is very important. And again, vitamin D was shown to reduce the risk of infection by 16%. So taken together, I think both these 2 drugs may play a very important role in keeping elderly people healthy as they age.
And I think a limitation they even said themselves in the study was that the dosage, I think, of omega-3s was much lower than other clinical studies that showed benefit.
Yeah, absolutely. And I guess they probably did a pilot study to begin with, and showed some effects maybe, and that's why they probably chose the dosage. But again, these are limitations that they agree with, and it would be very helpful to go back and have and think about what the data really means.
So after, looking through the data and how this study was performed, what are some implications you think can take away from this, or would like to look further into?
Yeah, absolutely. I mean, if you read the abstract and read the headline and see that there's no effect, I think it can be a bit demoralizing. But really, what I have found, and I'm sure Daniel, you agree with me, is that really, aging really needs to be different. And with I hope that if more elderly people take on moderate to high level physical activity that they are comfortable with, I think their effect on not only uh, the economy, the healthcare system, but really their quality of life will be much improved. And I think um, with more elderly people, staying alive in the next 30 years, that's going to be a very important aspect of healthy aging, really. And that's my take on it.
Cool. Doctor, thank you for your time. I look forward to having you explain to me what other studies mean in the future. So,
Absolutely. Yeah.
yeah,
I look
let's
forward
do this
to.
again.
Yeah. Take care, Daniel.